So very good afternoon to all. So we are discussing about the various patient monitoring equipments. So in the previous class, we have discussed about the other instrumentation equipments for the monitoring of the patients. So in addition to regular equipments for observing the signals for patients, so we can use the ECG waveform, ECG, EMG, EEG signals, and recording equipments and respiratory equipments. So in addition to that, we have some other instrument systems are there, and those instrument systems are discussed. So such are surgical equipments and arterial surgical surgical monitoring system and arterial diagnosis unit and catheter lab. So these are some other instrumentation equipments required for the monitoring the patients. Okay, so in the today's session we'll see what is the organization of the hospitals for patient care monitoring. So how we have to see or we have to arrange what are the different equipments or that is what facilities, or services, and these services how to arrange in the hospital, and those will be discussed in today's session. So coming to organization of the hospital for patient care monitoring. So how we have to organize the hospital? So it means what are main facilities we required. So that is nothing but suppose to do some surgery, we require some surgical operating theater room. Okay, so to do some analysis, blood collection unit, sample collections. So you require some lab equipments. Okay, and similarly to analyze the patients after surgery, so we have to use some monitoring units after surgery. Okay, and after surgery we have to check the patient condition for for some days. Okay, so like that we have to some uh, other facilities also should be required. Suppose if there is any sudden accident was happened, so how we can treat that patient. So how what are the main facilities are required. So how we have to save that life of that patient. So for that we have to some additional facilities or um, equipments or some areas services are provided by the hospitals, and those we will see here. So that is an engineer or technician should be familiar with the overall organization of the hospital with respect to monitoring the equipment. So by monitoring the equipment, the engineer or technician who is there in the hospital, he should be aware that what are the various facilities or what are various departments maybe have in the hospital. So nowadays the hospital and the engineering colleges are combined. So for the better service for the people's patients. Okay, so by that we have the engineers or the students or the students which are working there, they should also know the what are the facilities providing that particular hospital. Okay, so and the professors, what are different departments are present in the given in the working hospital or the studying college. So in the college, the students have the real practical experience with the supporting college, and the hospital, because these two are have same. Okay, there is no separate college and separate hospital. So hospital is the part of the this college. Okay, So where the students will serve for the patient and learn the things. Uh, for coming to general equipments, facilities and services in the hospital are broadly classified as general equipments and facilities, and also the services, what are different services provided. Okay, and those are broadly classified as surgical facilities or services, non-surgical facilities or services. Okay, so the first one is surgical facilities. So what types of the surgeries will be performed in the operation theater? So going to the first one, surgical facilities or services. So generally the heart of the surgical facilities is the main heart of the surgical facilities. So what is nothing but the operating theater. So our operating room. So operation room. Okay. So where the real surgery will be performed. Where the real surgery will be actually performed. So the surgeries may be different. Surgery type of the surgery is different. Okay. The surgery may be heart surgery. Okay. Abdominal surgeries, knee surgery, foot surgeries, liver surgery, so like that, lung surgery. So the operation which is performed for a particular organ of the body will be considered as that particular name surgery. Okay, so for any type of the surgery, so we have to arrange certain equipments in the operation theater or operation room. So in the operation room, the following monitoring equipments are present, which includes, so main equipments will be present are, so measurement of the heart rate. So first, for any type of the operation, you should note down the heart rate. So because that is the main. So while doing surgery, the so much of blood is comes out, and due to that, the pulse rate will be decreases. The pulse rate is goes on decreases, it is a very critical position for the patient. So for that purpose, the continuous monitoring of the or measurement of the heart rate is required. And venous and arterial blood pressures. So blood pressure, measurement of blood pressure is also important. So for that, doing such measurements, so we have to provide some equipments. Okay, and the measurement of the ECG and ECE. Okay, to measure these signals or potential biopotentials, we require some ECG machine or ECG machines. Okay, and various respiratory therapy devices, and also we require respiratory therapy devices. What we have seen in respiratory therapy in last unit, so different pulse oximeters. Okay, so providing some oxygen, that is ventilators and respirators. Okay, so those equipment should be provided in the operation theater. Okay, and also having necessary emergency equipment on hand, such as, so in addition to these equipments, so we have some additional equipment. These are called as emergency equipment. If suppose any sudden change in the heart rate, so we can provide some external stimulation. Stimulation means we provide some external like shock. So that should be provided by the following emergency equipment. So those emergency equipments are pacemakers, defibrillators, resuscitation devices, and stimulation equipment. Okay, resuscitation devices means life-saving equipments, life-saving medicines. Okay, and by using this resuscitation devices, so we can save the patient's life. Okay. Similarly, pacemakers. So by using these pacemakers, so we can provide the when the pacemakers are used means when the heart is not functioning with the sinusoidal potential. So we are seen in the details of the heart construction. So how the potentials are transferred from the sinusoidal node to the sinusoidal node to atrioventricular nodes. So there there is a natural pacemaker is there. So that natural pacemaker will provides the potentials to the heart, potentials are the pulses to the heart, and due to that there is a vibration of the heart. If that sinoatrial node, if that sinoatrial node is unable to produce the natural potentials or pulses, then we have to provide some external, artificial or external, we will apply the pulses to the heart, and by that heart will produces the normal functioning of the heart. Okay. So for that we can use the pacemakers and defibrillators. So the defibrillators are used. So for this is also for the to give the excitation for the heart. So you may see in many cinemas. So there is a two uh, plug-like structures. So they will put on the chest. Okay. So they can be by giving shock. So due to that the heart may be excited. It will comes to normal operation. So you may familiar is seen in Shivaji movie. Shivaji movie. So in that the doctors will be give the defibrillation when he was going to somewhere. Okay. So that hero Rajni was treated treated by the defibrillators. Okay. So that is also one of the treatment. So when the heart functionality was lost within some seconds. Okay. So we can also provide high potential like shock. So that will be applied to patient. Okay. So like that we can use these life-saving equipments and stimulation equipment. So this stimulation equipment is also type of the stimulation. It will suppose sudden light or sudden sounds will provide some sudden shock to the patient. Okay, so like that we can use this emergency equipment in operating theater. So in surgical facilities, these are surgical facilities provided in operating theater for doing the surgery or applying some uh, for proper operating of the heart. And the next one is non-surgical facilities or services. So up to now we have discussed about the surgical facilities, and coming to the next one is non-surgical facilities. So in this we are not provide any surgery for the patient. So but these are also very important non-surgical facilities for monitoring of the patient. So the following units or services will present in the hospitals as non-surgical facilities. So the first one is intensive care unit, coronary care unit or cardiac care unit, intermediate coronary care unit, emergency room, paramedic services, mobile emergency care unit. You can call it as ambulance services, ambulance service. So these are the 6 different non-surgical facilities should be provided by any large sized hospital. Okay. So the first one is intensive care unit. So all of you know that intensive care unit. So it is used for post-surgical follow-up. So after surgery is performed, so we have to observe the patient for 2 or 3 days. So for that observation, so the patient should be placed in a ICU unit. And for medical patients with very serious problems, so suppose any patient is came from a very serious problem, first he will be joined in the ICU unit. Okay. So similarly, the equipment in the ICU is similar to as the operation room. Okay. So whereas the equipment in the ICU unit is intensive care unit is the same as the equipments present in the operation theater. But in the ICU, we have a number of beds will be there. Okay, so depending upon the number of beds, for each bed we will require bed monitoring equipments, patient monitoring equipments. It may be for each patient we require uh, ECG, ECG device, respiratory devices, and we require display devices for each patient individually. Okay, so like that, the set of instruments for each patient is to be arranged for the other beds also. Whereas in intensive care unit, we have number of beds for each bed. The same equipments which are used for each bed is arranged for the remaining all other beds also. So that's why the number of equipments should be provided in the ICU or more number when compared to the operation theater or surgical theater. Operation theater. Whereas in operation theater we have only one set of all the equipments, life-threatening equipments. Okay, so there are number of bedside monitoring units are connected, and these units, all these units at the bedside are connected to central nurse station to monitor all the patients at a time or simultaneously. Simultaneously or at a time, we can observe all the patients' condition or monitor. We can be monitored. Okay. So similarly, we have another one, that is non-surgical facility. So that is coronary care unit or cardiac care unit. Coronary care unit or cardiac care unit. This is called as CCU. So most of the heart attack cases are placed in a coronary care unit, and it is also called as cardiac care unit. Suppose a person is came with heart attack, first he will be joined or placed to this coronary care unit. So here, for monitoring of the heart, we have used the different monitoring equipment such as blood pressure, heart rate, and ECG recording device. Okay. So these equipments will be observed in CCU, coronary care unit. Okay. Similarly, we have another unit, so that is called as intermediate coronary care unit. So intermediate coronary care unit. So this intermediate coronary care unit is used when a patient is recovering. So suppose a patient is due to heart attack, he was recovering. So due to some problems, due to some medications, he was get curing. So okay, so those patients should be monitored and usually move to another unit where the monitoring is not as critical. So whereas in cardiac care unit or coronary care unit, for the critical patients should be treated. So after treatment of that heart attack patients, and those patients will be shifted to the another unit. So there the patients should not have that much of critical situation. So that particular unit will be called as a intermediate coronary care unit, ICCU, intermediate coronary care unit. So it may contains telemetry equipment to monitor ambulatory patients. So it is generally, in addition to the this ECG and blood pressure measuring equipments, so it is also having a telemetry equipment. So this telemetry equipment will be sends the signals to other sends to doctor or nurses. Okay, right. So the next one is emergency room. The next one is emergency room. So emergency room. So it is very important facility or an area in the hospital is the emergency room. So in which emergency care is provided. Okay. So here every patient is a possible crisis. So they are having certain critical problems. Okay. And for this reason, emergency rooms require equipment of same types described for other facilities. So in emergency room, we should provide all the equipments which are provided in other intensive care unit and ICCU care units. What are the equipments in other facilities are provided? All such types of the equipments are should be provided in emergency room. So because if suppose I want to check the heart rate of the patient, suddenly you don't shift this particular patient to a far away distance of the ICU. Okay, so if it is possible, we can shift immediately. So, for that to check immediate equipment, so all the equipments are needed equipments are should be provided in the emergency room. So in some cases, it is required to move corresponding units. Suppose we have to take the X-ray of the patient, so we should not shift to X-ray room to the emergency room. So we have to move the patient to X-ray room. Okay, so like that, we can arrange the all the equipments in emergency room. And for rapid diagnosis, so for suppose we have to know the suppose a patient a sudden accident was happened, and by using ambulance that patient is shifted to emergency room, and after reaching the emergency room we have to identify the what is the blood group of the patient. So what are the different blood group and blood requirement, so and also different diagnoses. Okay, so what is the hemoglobin percentage of the patient? Okay, all these should be diagnosis. So by using for diagnosis purpose, there are blood samples and urine collection samples. So lab equipment section. So lab equipment should be arranged near to this emergency room. Okay, so like that, certain lab diagnosis and sample collection. After collecting the sample, we have to diagnose the blood samples. Okay, and according to that, we can give the treatment. Okay. To do all these diagnosis and sample collections, some lab equipment should be present. If suppose if there is any critical measurements are required, so that is we have to shift the patient to operating room or in ICU. Suppose something has happened, okay, so we have to do some surgery immediately. So then from the emergency room to by doing by doing some initial checkup all those things, we have to shift to emergency room or we can shift to ICU. So depending upon situation of the patient. So like that we have emergency rooms. Okay, we have that emergency rooms. Okay, so the next one is paramedic services. The next type of the services should be provided by generally the hospitals are paramedic services. So this paramedic service is nothing but if a patient he or she have a heart attack at home or in the street, suddenly in the home or in the streets he may be get the heart attack. So the person's information, okay, so that person information is connected to the nearby hospital by the paramedic services. This is THED. Okay. So this is provided by the individual private hospitals. Okay. So generally what happens? So when a person is uh, done by a heart surgery, okay, so he will be we will insert a chip in the heart. Well, after doing the surgery, so you will insert a chip in the heart, so that chip will takes all the signals of the heart, and those signals or pulses of the heart will be sent to near provided hospital, and at the heart we are using a chip, and that chip is having a transmitter, and the transmitter will be transmits the signals to the nearby hospital. If any uneven signals are generated. Suppose the sudden blockage or sudden variations are occurred in the heart rate or heartbeat. So that will be that information is transmitted through transmitter, which is placed near the heart to the nearby hospital. Okay, and immediately that patient was um, saved. Okay, if there is any problem, so they will be take care. Okay, so that information should be sent to nearby hospital. So these services are provided by the private hospitals. Okay, all the time they don't serve the patients. Okay, so they, if there is any problem, that problem is identified by transmitter. The transmitter will be sends the information to the nearby hospital, and according to that they will be sends an ambulance or some medical care will be taken. And the next one is and the next and very important service is the mobile emergency care unit. So mobile emergency care unit. So what is this mobile emergency care unit? It is not a cell phone emergency care. So here the mobile means movable. So by moving, okay. So moving means by moving you can provide the service. So that is provided by vehicles. Okay, here vehicles are ambulances. Okay, by ambulance services you can provide the monitoring or care for the patients. Okay, by using this mobile emergency care unit, we can provide the first aid for the patients if there is any accident or happen in highways, especially in highways, we will get more accidents. Okay, so this mobile emergency care units will provide immediate and around the clock medical care. Okay, so they will provide immediate care for the patients, and also 24 hours they will provide the services. They will provide services. Okay, and care to heart attack and accident victims. So the patient, the accident happened, patients. Okay, they will provide the contents, the quick monitoring, and medical care should be provided by using this mobile emergency care unit or ambulance services. Okay, so to provide such medical care or emergency care, so after taking the patient into the ambulance, so a, a trained person, so a trained person should be do all the services. So that is what are the services. First, when the patient or the accident victim was taken into the ambulance, so first he will do the first aid. Okay, so first he will able to do all the services. That is, he may do the first aid services or life rescue techniques. You should know he is able to apply the life rescue techniques. Okay, so life saving techniques. Okay, so he has such abilities, and that vehicle, so what are the mobile that ambulance vehicle should have the instruments and medicals medications. Okay, so it should have the all the instruments, should have all the equipments with the instruments and medication similar to that used in the special care units of hospitals. So in the special care ICU units or some other emergency rooms, how they will be do the measuring of different parameters and how they will be give the treatment to the patients by using some medicines. So all such equipments and the medicines should be present in the this ambulance vehicle. Then only the trained person or the attending person should be do the required things for the accident patient. Okay, so These units are in constant radio contact with the police, fire, and hospitals. And these emergency mobile care emergency or ambulance services are has the constant and contact through radio. So they have some connection with the police, fire, and hospitals. Okay, suppose something was happened in the city, so that information when is from sent to the police and fire station. Okay, so immediately the police services and police department will give the signals to the um, traffic police, and the traffic police members will provide the clear the traffic uh, for this ambulance services. So like that, they always this ambulance services will have contact with the fire and police department, and also to the hospitals. So suppose if anything was happened, what these attendant will perform the first aid services, all those things, and those information continuously should send to the hospital. So what is the situation of the patient? Okay, if any medicines are required, okay, what medicines should we give, and what is the pulse position? So according to that, that information, all that information should be transmitted to the hospital. Okay, that facility is called as telemetry facility. Telemetry, the patient's information, all the information was first measured, and that information was transmitted to the nearby hospital or the corresponding hospital. And where the hospital, in the hospital, the doctors or specialists will observe that information of the measurements done for the patient, and that information, after based on that information, the doctors or the attenders will give the suggestions for this attender who is present in the ambulance. So they will suggest the attender to do in such a way that, like that, they will give the suggestion, and he will be perform the action to save that patient. Okay. So when so first of all, this attender will when the patient will be taken into the ambulance. So first he will check the ECG, the ECG. So that is pulse rate of the patient, and obtains the ECG waveform. So to do this ECG waveform, we have to use a portable type of the ECG machine. So that by using portable ECG machine, we can obtain the ECG output. Okay, and if there is any life saving techniques are required, he will do that one. Okay, so after reaching the hospital, so while going on the ambulance, so he will give the some information to the doctors through telemetry, and according to the reply of the doctors, so he will do the required things for the patient. Okay, so when the vehicle is reached to the hospital, the patient is checked by, the patient condition is checked by or monitored by the appropriate equipment inside the vehicle. Okay. So after reaching the hospital, so he will be again carefully monitored. So what are the equipments which are used in the hospital, which are used in the ambulance? The same type of the instruments which are used in the ICU unit or the operation theater room, and those with those equipments we can save the patient. So in this way, we can uh, save the person by timely providing services to the accident services of some heart attack patients. Okay, so like this, we have different non-surgery facilities or services. So these are the different non-surgical equipments or surgical services. Okay. So if you have any doubts in this record, you can put a chart, put in the chart. So with this, I am closing this session. If you don't have any questions.